Today we're going to learn how to use your Follistim pen. Follistim is a brand name for a hormone that your body naturally produces. However, we're going to give you more in your IVF cycle than your body would be able to produce because we're wanting to retrieve as many eggs as possible. So that particular hormone's name is follicle stimulating hormone, or FSH. You may hear it called FSH in the ART department. We use a lot of acronyms. So slow us down if we need to, but also you might note on your calendar it's written as FSH, and that's because the other brand name for FSH is Gonal-F. They're interchangeable. They both do the exact same job. Whatever your pharmacy, insurance, or package has provided for you, it's absolutely okay to use that particular medication. So before we clean our hands, I want to open up the pen because you do need a kit along with your medication cartridge to get started. So this box, you're going to open that up. It's going to be something you'll probably carry along with you or have with you throughout your stimulation cycle. Just keep it in the same spot. If you ended up needing to go to a friend's house for dinner or out to dinner, you'll need to take this kit with you. In this kit, you're going to find your actual pen. It looks like an ink pen. It's blue. This ink pen comes apart in parts, so you've got a cap that just pops off, and then this yellow portion spins off. That's going to be what we insert your cartridge into, okay? So just set that aside apart. The next thing you're going to notice in this kit are you've got your needles here, and these are daily. You do not reuse this needle. This will be one particular for today's dose. So go ahead and set your box aside. Your cartridge, now this is the medication. These cartridges come in different dosing. You may find a 300, you may find one that's as much as 900 units. That's okay. It's just how many are in each cartridge. And so you can use these cartridges from day to day. Please do not dispose of them from day to day, as there is still medication in here that you'll want to use. Go ahead and open up your cartridge. When you open up your cartridge, it's going to look like this. They've given you more needles, and the actual medication is in a little sealed clear plastic container like so. Open that up. We're going to load our pen. All you have to do is load it. When you have your cartridge sitting upright, the metal is towards the ceiling. I want you to just drop it down over top of the end of this black portion in the pen. You're going to take the yellow cap of the pen that we unscrewed, place it on top. We're going to push down. Then you're going to screw that back on. Okay? The next thing I want you to do is peel the paper top off of your needle for today. And you're going to screw that on top of your pen. Just like so. Set this aside. Let's wash our hands. So use your alcohol. Warm water and soap is actually better. But if you're not in a place that has that, rubbing alcohol and rubbing your hands together until it dries is the best way to do this. Then I want you to prep your skin. By doing that, we're going to take our alcohol swab. We're going to rub our skin, and this is the belly skin that we're going to be doing our injection in. And remember, you can move from site to site. We just want to, in that belly fat, we want to stay about an inch away from your belly button. Let this air dry. We're ready to inject. To dial our dosing, you're going to notice that on your calendar, you'll have the opportunity to write in your dosing. Your doctor has chosen a dose specific to you and your cycle, along with your health history. For the Follistim pen, a typical dose may be as little as 75 units a day or as much as 450, and anywhere in between is absolutely okay as well. When you're dialing, you're just clicking the pen till you see your dosing. We're going to go to 225 today because that seems to be a popular dose for some patients. Now, if I were to make a mistake and dial past my 225, you'll see a window with the number here. It's absolutely okay. For Follistim pen, all you have to do is dial all the way up till it won't let you dial anymore, and then it will actually let you reset all the way down to 0 again. So we'll just start back. Let's find that 225. We'll go a little slower this time so we don't miss it, and we're there. All we have to do is remove the safety cap. There's actually 2 of them. They want us to be extra safe. Take this second safety cap off. No priming needed. Our skin is clean. We're going to pinch the skin towards our belly, go straight in, and with our thumb we're going to press and we're going to click through till we see the 0 in our window again. So clicking all the way down, we're going to see the yellow part of the pen come flush with the window. Pull that out when you see the 0 right here, and then you're done. For today, what I want you to do to dispose of this needle is take this cap, put it back on, unscrew your needle, be very careful, put it back in your sharp spin, and you're ready to go for tomorrow.